Okay, this is Shred's protocol for the lower extremity. I'm going to start off with the gluteus medius muscle test. Go ahead and resist. Go ahead and resist. Okay, indicators of pronation protocol would be a positive navicular drop test, or a posterior lateral heel wear, or a patellar approximation. So I'm going to start off with the navicular, cuboid, cuneiforms, met heads, talus, and then calcaneus, phalanges, fibula head, and retest. Go ahead and resist, and it's strong. Okay, for the iliopsoas muscle test, it's up 45, out 45, and externally rotate the leg, and have her resist. It's weak. And up 45, out 45, externally rotate the patient's leg, resist, and it's strong. Other supinator indicators are the negative navicular drop test, excessively high arches, a combination of inversion, adduction, and plantar flexion. So for the supinator protocol, I'm going to start off with the navicular cuneiform test adjustment. And then the cuboid, and then the metatarsal heads, and then the talus, and then the calcaneus, phalanges, and then the fibula head. And then retest. So up 45, out 45, and externally rotate. Resist, and it's strong. Okay, so now I'm going to assess the knee, or the knee adjustment. There's three possible listings: a medial condyle, a lateral condyle, or a posterior tibia. So I'm going to lock out the knee. And okay, so she has a medial condyle listing. I'm going to go ahead and have her flip over. I'm going to raise the leg, tissue pull medially. Okay, and recheck, so go ahead and flip over for me. Lock out the knee. Okay, no medial movement. Now for the anterior femur muscle test, I'm going to have her raise her leg 45 degrees and resist. And let me test the other one really quick. Resist. Okay, so she's weak on this side. And I'm going to flex her hip. Okay, so adjust, retest, and it's strong. Now for the alternative talus adjustment, since talus is normally subluxate laterally and slightly anteriorly. I'm going to go ahead and have her flip over for me. And that's good. So I'm going to come in here like this and adjust P to A. And then go ahead and flip over for me. This adjustment now is for the big toe. So I'm going to come in here, and adjust. Now for a bunion adjustment, which she doesn't have one, but you support the calcaneus here, and you do an adjustment like that. Okay, so now I'm going to test the patella, and I'm going to test it in all directions for springiness and resistance, and I find a resistance laterally, so I'm going to adjust laterally. And recheck. And the resistance is gone, it's springy again. Next I'm going to test for the internal external rotation of the femur by doing a muscle test of the tensor fascia lata. So it's up 45, out 45, internally rotate and go ahead and resist. And it's weak. So I'm going to first test for the internal rotation. And this is A to P. I'm checking for springiness. It feels okay. Now external rotation test. I'm checking for, P to A direction is my vector. And I'm checking for springiness. And I feel resistance, so I'm going to go ahead and adjust. And then recheck. Okay, resist. And it's good. Strong. Okay, for the wrist extension technique, you're going to make a fist like this, and this is your non-dominant hand, your pressure hand, and you're going to apply even pressure throughout the table. And then this is your speed hand. You're going to make a fist like so, and you're going to apply pressure and flick. Okay, now for the knee test, I'm going to lock out the knee and push lateral to medial. And there's a medial listing. I find a medial listing because it moves from lateral to medial. So go ahead and flip over for me. Okay, so with my pressure hand, it's 50 to 70 pounds of pressure, and with my speed hand, it's 10 to 15. So you're going to locate the crease, and then you want to go medially. You want to go. Okay, so go ahead and flip over for me. Going to retest. Lock out the knee. And there's no movement. Okay, so for the anterior femur test, I'm going to have the patient raise their leg. Go ahead and resist. And it's weak. So I'm going to locate the greater trochanter and go medially and inferiorly. Go ahead and scoot. So with my pressure hand, I'm going to apply 10 to 15 pounds of pressure, and with my speed hand, it's 15 pounds or 10 pounds of pressure or speed pressure. Okay, go ahead and raise your leg. Resist. And it's good. Okay, for the anterior humerus test, I'm going to have the patient raise their arm and go ahead and resist. And it's weak. So I'm going to go ahead and have the patient guard themselves, and I'm going to be looking for the pectoral deltoid line, right? So right here, I'm going to apply 15 pounds of pressure, and with my speed hand, it's 10 pounds. And look that way. Okay, so let me go ahead and retest. Go ahead and resist, and it's strong.